Hi, my name's Kelly Gilson, and I'm the Executive Director at United Way Oxford. I invite you to join us on our new Let's Talk Local Oxford series. We'll share everything about United Way Oxford, our work, our partners, our investments, and how everything we do is designed to create positive social change right here at home in Oxford County. Not only do we want to share, but we hope to inspire you to join in our efforts and learn ways in which you too can show your local love. So, let's talk local, Oxford.
Woodstock Libro Credit Union is the proud sponsor of Let's Talk Local Oxford.
Welcome back to Let's Talk Local, Oxford. I'd like to begin the podcast by thanking Libro Credit Union for their sponsorship. They are a generous and really committed corporate partner, and we are grateful for their efforts in supporting our message across the community to share what United Way Oxford does and what some of the work of our amazing partners, the impact that they're having across Oxford County as well. So on today's podcast, we will be chatting with two wonderful women from the Ingersoll Nurse Practitioner-led Clinic, which is a mouthful. And we have joining us today Stephanie Nevins and Jessie Rumble. And I'm going to turn it over to you ladies to better introduce yourselves, and then we'll get into our conversation.
So I'm Jessie. Thanks so much for having us. I'm the clinical director and lead nurse practitioner at the Ingersoll NPLC. So my role is both on the front lines clinical, providing primary care to patients' families of Oxford and area, but then I also have an administrative and leadership side, working along with Stephanie to lead our wonderful team, build these community partnerships, and plan for the best services across the region.
Excellent. And Stephanie?
Great, thank you. Thanks for having us today. I'm Stephanie Nevins, and my role at the clinic is the clinic manager. So I'm the behind-the-scenes person that works closely with our team to help them identify what our community needs are, but also understand who those community partners are that we want to work closely with in our organization, as well as our funders, the Ministry of Health.
And it's funny because just before we started, I said, it's hard to really talk about how exciting paperwork is, but where I'm going to go is Stephanie is the one that really handles the United Way, the application, the interview process. I know people often think that as a fundraiser, that's the hardest work that we do. And it's certainly, always challenging, but it is as much work to invest those dollars wisely in our community, and the process is long. I would like to think not torturous, but long, and really involved with our partners. And you do a stellar job in representing the Ingersoll NPLC, which is so much easier. So thank you very much for the work that you do. So we're gonna just hop right into this and talk, I think, just maybe if one of you could give a little bit of an overview about what a nurse practitioner-led clinic is, at the high level. And I know that's, United Way's role is not in much of that. Ours is very specific, but just a little bit of a view on what it is, and then we'll get into the United Way connection specifically.
So nurse practitioner-led clinics are primary care models in province of Ontario, and what's unique about them is they are nurse practitioner-led. So we support almost 3,000 patients in Oxford area as nurse practitioners, as the most responsible provider or primary care provider, similar to a family doctor. I think what's amazing about our team is that we have nurse practitioners providing that care, but we also have a team of social workers, nurses, and administrative professionals that support patient care in so many other ways, which allows us to offer mental health and addictions counseling, walk-in counseling, chronic disease management, ongoing counseling, to provide more holistic and sort of inclusive primary care.
That's fantastic. I just think it's important to share that, because not everyone may be familiar with the model of care that you offer and the impact that's having. I mean, 3,000 clients is a really significant impact.
Not quite 3,000, almost. I would want to say maybe over 2,700. Yeah.
But that, I mean, that's a significant impact on our community and the health and well-being of people across our community, all ages and different backgrounds, etc. And now if we could maybe specifically speak about where United Way has come in to fill a gap that wasn't filled specifically by sort of government healthcare funding dollars, correct?
Yeah, so I can speak to that a little bit. We were actually really fortunate. One of our in-house community partners is CMHA Oxford. Formerly, that was what they were called. And they came in and they would work sometimes running the walk-in program that was also supported by United Way. And we just continued to see this inundation of individuals coming in and hoping that they would have an opportunity to see someone. And this was pre-COVID times actually that we originally kind of caught light of the situation that was very rapidly continuing to grow. So, at one point we would have 4 or 5 people in the waiting room, and then it turned into 8, and then it would turn into 10, and then we were turning people away because there was just not enough time in the day to see everyone.
Which I think speaks volumes to both need, but also, as you said, that was pre-COVID.
Yes.
So imagine the difference now.
That's right. Yeah. So we kind of had a look at that and thought, I think there's a need here, and we need to find a way how we can do more, because the people already in the community knew that they could come to our location. So really wanted to leverage that they already felt safe to come there and that they knew that's where to go. And then of course COVID happened, and at the initial onset of COVID, we were not having actual walk-in, it was more like talk-in. But the need just continued to rise, and new challenges, and seeing a whole new landscape of individuals that were coming in that we actually weren't seeing before, with all the new challenges that were being presented from whether it was job loss or family struggles, parents being full-time parents and full-time employees working from home and all those things. Mm-hmm. So that's where that initially was developed, and we just thought, let's talk to our partners and figure out how we can work together to be part of this solution.
I think what's really amazing is seeing how our partnership and gracious support from United Way Oxford has evolved and grown over the last 2 years working with them. So, partnering with CMHA and the Oxford Community Health Center to provide the walk-in services, hiring a wonderful counselor with a passion and expertise, but then seeing how that's evolved to identify further need in the community. So towards the end of our last year, it was identified that there were no services for individuals seeking transgender care. No gender-affirming care in Oxford County exists. She came with a background, a passion, and expertise, and from that, and with the support of the United Way, we were able to bridge and link the two. So she started to see some of these, individuals through the walk-in program, and then with United Way's support, we were able to then continue that on and expand the trans program. So now we are actively accepting referrals for it's not just walk-in counseling, but also providing full transgender care for Oxford County residents.
And that is such an important piece of, I think, of United Way's work, in that we want organizations, we develop a strong funding relationship and a strong partnership, and we really value learning and growth and opportunity, right, for us as well as obviously the agencies. And when your staff team were able to identify a very specific gap as well as a very specific need, it was a wonderful opportunity to come together to say, how can we fill it? And I applaud you for jumping in to fill that gap, really on behalf of the county. So now you're doing a few different programs actually with our funding.
Yeah. Oh, it's been amazing to see how it's all come together and how many new partnerships as well. So our counselors actively involved in Oxford Pride, as well as the remind me the
Situation table,
working closely with CMHA to make sure isn't a duplication of services in the area as well, along with Woodstock Hospital and looking at evaluating the programs and the need and uptake that we're seeing. We've also now partnered with the Thames Valley Family Health Team for the trans program. 2 of their nurse practitioners will be supporting and seeing patients in Woodstock for those who are seeking medical services. So things like hormone initiation or surgical referrals.
Which is also fantastic because we say here all the time that it takes a village, and it really does. It takes a village to raise a child. It takes a village, I always say, to raise a village, right? We're part of that. But this is a great example of how that togetherness really does make the difference. And we know specifically for mental health supports, and we've heard from community members for years, people wanted access to timely, local, accessible, relationship-based supports, right? That really matters. And the fact that you've been able to evolve and continue to partner and reach out and connect so that transportation becomes less of a barrier is really important as well.
Yeah, it was great to be able to identify, okay, the program's been developed now, we know what the needs are, we know how to do the work, now how do we make sure that we're serving the patient as close to home as possible? So,
and what's really important, and what part of our role is to work really behind the scenes to try and sustain this, right? Because we're so grateful to United Way, that funding, to be able to offer this and to demonstrate to our permanent funders, the Ministry of Health, that this is a need. And it's we're already actively seeing this because unfortunately that funding isn't always available through our pathways. So we're just so grateful and fortunate that we're allowed to support these vulnerable populations in the community.
And there really are, whether it's folks that are taking advantage of either aspect of your programs, people are very vulnerable. And the fact that they consider the Ingersoll nurse practitioner led clinic a safe and welcoming place matters a lot. And it's the right door, right? To go in, to access supports. And we are pleased to be able to help you build the case. And I think that's one of the things that United Way, as we've evolved our funding, we still provide core funding. We have a number of organizations we work with that receive 0 government dollars. And so they need every cent just to do what they do from us or from their fundraising efforts. But there's this belief that, well, if it's government funded, they must have all the money. But that is not the case, is it? You have to build the case, right? Show the impact. And when we can help you leverage that and do that, that's a wise investment of our donors' dollars to better the overall outcome in our community. So it's a pleasure for us to be able to do that, to support your work, and the feedback from the programs that you've been able to identify and provide is amazing. And maybe you could just tell our listeners a little bit about who the programs are helping, because it really is an amazing cross-section of our community, isn't it?
Yeah, it really is. We've been able to serve individuals from all over Oxford County, which has been really great, and really individuals of all ages. So there's not just been any specific population or specific need, but it's been a broad range of things.
So, typically 16 plus, because, we're fortunate Welkin in the community here, primarily will support more of our, pediatric population. Mm-hmm. So, 16 plus, reserved same day appointments. Somebody walking in needs to see, a counselor right away, that there is availability in the way that works for them, both in person, virtual, so through video or through phone, based on where they are. Individuals experiencing crisis, either, employment or relationship breakdown, those struggling with addiction concerns, those who might not know where to go and need support in navigating the system, right? Like you say, the first stop. The NPLC has been sort of a staple in Ingersoll for now over 10 years, right? So they don't, and people don't always know where to access. So,
and I think that's so true. I mean, we're all creatures of habit. We don't know what we don't know, and then suddenly, when you have a need, to know that door is open, that people are welcome to walk through, and that you will help them find the support within your own clinic or within the support offered by partners that you work so closely with. That can make the world of difference for someone. I think it's such an important aspect, and this walk-in clinic service, this wraparound support, I think in lots of ways is unique to Oxford County, identified to fill some gaps, and it really matters now more than ever before, because it has been a tough few years for everyone, and tougher for some. As we wrap up, is there anything else you'd like to share about the clinic, about the programs you offer, or even about some of the the responses that you receive from some of your clients?
Maybe I'll just close. I've got a pile of anonymous feedback here from patients. She has helped me so much. I was in a very dark place, and thanks to her for all her help, I am in a much better place. I am so grateful.
Well, Jessie, I can't think of a better note to end this podcast on, because that is why we are all here to do what we do. And that is why we are so grateful to our community for supporting and believing in the work of United Way and our efforts to work with wonderful, impactful organizations such as the Ingersoll Nurse Practitioner-led Clinic. One of these days I'm going to say that without stumbling. Sadly, not on this podcast. So Stephanie and Jessie, thank you both so very much for joining us today and for sharing a little bit about the good work that you and your team are doing for the people across Oxford County, and in particular Ingersoll, but certainly county-wide. And I would ask people to stay tuned for future episodes, because we will continue to share the work of our partners and of United Way's investments and our programs to show how together, more than ever before, we're creating positive impact across Oxford County and truly making a difference in people's lives, because that is what we are here to do. If you have any questions about this podcast or any of our previous podcasts, please reach out to Mike at unitedwayoxford.ca. He is our podcast guru. And once again, I would like to thank Libro Credit Union for their generous support, and thank all of you for joining us. And we'll see you next time on Let's Talk Local, Oxford. Take care. Thank you for listening to Let's Talk Local, Oxford. If you would like to learn more about United Way Oxford, our work, our engagement, our volunteer opportunities, our partners, or to even make a donation, please visit unitedwayoxford.ca or call our office. We love to chat, and we really love visitors too. If, however, you find yourself needing a hand to locate a program or a service, please call 211, our information and referral service. They're there to connect you to local supports 24 hours a day, 7 days a week, 365 days a year. Remember, 211, they are there to help. Until next time, join with us by showing your local love. We all could use a little more of that. Thank you.
Thank you for tuning in to Let's Talk Local Oxford, proudly sponsored by Woodstock Libro Credit Union.